Nice.
Okay. Good evening, everyone. As we know, today is a very special day, and that's why we're having a very special webinar. Usually my webinars are all on Wednesday, but today, because it's Nurses Day, I would like to welcome Miss Jane T. Miss Jane T was previously the head of school for nursing with UCSI. Am I right?
UCSI?
UCSI, okay.
Yeah.
And now she has gone in advance in her career. Yesterday we had to talk on actually career pathway for nurses, and no one has done it better than Jane T. She's now going to be the Chief Nursing Officer with KPJ very, very soon. So she's going to be a very influential person, somebody you may want to know in your career as a nurse. So without further ado, maybe Jane T, you'd like to start?
Okay, thank you so much, Betty.
Yes.
First of all, thank you, Betty, for giving me this opportunity. Okay, and good evening to everybody. Good evening to everybody. So I must tell Happy Nurses Day to all my beloved nurses, no matter whether you are in clinical side or whether in teaching area, and the student nurses as well. So I'm really felt glad that I've given this opportunity to give this talk on this special day for nurses, for me and for all of you here. So I feel privileged to be talking on this special day. So today I'm going to give a presentation on invest in nursing and respect rights to secure global health. Okay, you can stop me anytime. This is what I can, as what Betty have mentioned, I have gone in both lines. That means in a clinical side as well as the educational side. So, so that I have evaluated what is the needs for the nurses currently and where the area that we need to invest for nursing in the future. Okay. So yeah, at the end of the session, I really appreciate if some of the leaders can also share with us something. So in the future, we can come up with some idea for our future nurses. Okay, let me just go through. Okay, first of all, oh dear. I cannot go through it.
Are you using a
okay.
Okay.
Okay. So what I'm going to talk to you today is more like a relaxed talk that all of us, to put all of us in a track what we have gone through for this last 2 years. So we have gone through as a nurses a lot of challenges throughout these very difficult 2 years. So I wanted to bring you all back, all your memories back for the last 2 years. Second thing we wanted to do is what are the lessons that we have learned as a nurse in this throughout these 2 years journey we as a nurse. Okay? And also the third one is I'm going to analyze on the needs of the nurses and specialized nurse, not only in Malaysia but globally. And the fourth one, I wanted to do some recommendation that I think that will be quite useful for some of us here to see which are the area we need to really focus on investing the nurses, because investing nurses means equivalence to investing for global health. Okay, let's go back to what really happened in 2019, in November 2019. So we was really been alarmed by news on this Wuhan province in Hubei, China. They have first detected a disease in a very small, we don't know what's the disease all about, a new imaging disease with a small scale in the November 2019. And we know that it became the first cluster in China. At that point of time, all of us not aware what is this disease about. Some of us was telling SARS-2 and all this kind of thing, how we want to overcome it, what we're supposed to do, how we wanted to prevent it, and what are the treatment. We are really not aware. We are really unaware of what's really happening to us at that point of time. So then what really happened at the disease progress and progress so soon? Now we know COVID-19. What is COVID-19? We know about, we have a lot of policy and procedure about COVID-19. And COVID-19 was declared as a pandemic by WHO that was affect the life and health of more than 1 million people across the world since 13 December 2019, when it's first declared as a pandemic. So what really happened in Malaysia? Let's go back to Malaysia scenario. So at that point of time, our Prime Minister, Muhyiddin Yassin, have actually announced movement control order on the 15th of March. At that point of time, none of us aware what's really happening to us. We was thinking about what really we heard from our grandparents about MCO during the Japanese time. So we are all rushing to the supermarket and getting our glossaries done because we are so afraid of we won't get the thing that we're supposed to get. Okay, that means the common people, all of us do that. So what really happened to the public then? They have gone through a tremendous challenge in their life. They have to go through, the public have gone through, each one of them have gone through a very challenging period in their work life routine. Not only the adult, even the children have gone through a difficult period in their lifetime, whereby they are not aware that they have to sit at home, not going to the school, not been communicating, don't have any physical interaction. And the pity thing is, some of them, as I'm at the point of time I've been in a clinical area, we are aware some of the people are alone at home seeking for help. Some of them uncertain about their health, especially when they're alone, and they are not aware what's happening to them. And the pity thing is, some of them don't have economically, they have been drained as well because of the retrenchment and everything. So due to that, we have gained quite an during the MCO, we have impacted most people psychologically, being really stressed. That's the common people. So what happened to ourselves, nurses? Okay, nurses around the world, not only in Malaysia, let me put it that in a very, make everybody is very clear that not only us, throughout the world. So that means I'm talking on behalf of all the nurses in the world. We have faces a great challenge. We're not sure of the situation. We are not sure of what's really happening. We are having impossible things to do, impossible decision that we have to make with a limited resources, and we have a great pressure to go through. Okay? So this is what all of us are facing. So if you can actually reflect back, these are some of the news that we can see in the newspaper during that period of time. You have seen how difficult the nurses have gone through, how they have sacrificed their life. I mean, sacrifice their time that that is supposed to spend with their beloved one. They have to be 24 hours in the hospital. They have gone through even sores in their faces because they have to wear the mask, and they have geared up their they have to gear up with all the necessary PPE, even more than 12 hours to care for the nurse, for their beloved patients. So all the sacrifices is being highlighted in mass media throughout this pandemic, right? So we are aware that the nurses' experience have been highlighted. The crisis that the nurses gone throughout this COVID-19 have been highlighted so much in mass media. Okay, so most of them know about this thing that happening to the nurses, even though they actually heard from the another person, but we have experiences together, whether to the some extent, right? So with that, I'm just reflecting back what is the issue that we have during that period of time. So we know we have a lot of issue during that period of time. First of all, is the human resource issue. We have a shortage of nurses in the screening area, okay, and also treating of COVID-19 at that point of time. And we also, as at the point of time, I'm a leader in a clinical area. We have identified there is a critical shortage in emergency department, infection control and critical care, and also in community nursing, because some of the elderly people is left alone with COVID, you know, especially in the rural area. So this is something that we have to address. Okay, today in the radio station, our Deputy Director of Nursing of Malaysia have mentioned she even have to deploy the nurses from one state to another state to ensure there is enough manpower, especially in the Ministry of Health hospital. Okay, so but they even have to work more than 12 hours to ensure the patient have been taken care of. Medical resources. We also really face a critical challenges in getting the essential medical resources, such as surgical masks, face shield, apron, and etc. At that point of time, nurses have been so creative and innovative, whereby they created their own face shield, you know, because at that point they are very, very really shortage, and they have created their own apron and all these kind of things to ensure they actually can protect themselves from this COVID-19 as well. So this is also a big challenge that we face during the COVID-19. The knowledge deficits that we have really faced is due to imaging disease. We are not sure at that point, at certain point of time, how this is separated. We don't know whether it's droplet, we don't know whether it's airborne at that certain points. And we also not sure whether, as a nurse, whether we are safe to actually take care of these patients. We don't know whether the nurses find a great challenge. I really have come across with nurses who really cry to me to say that I'm not going to take care of this patient because I'm worried about the safety of my family members. So, in fact, these some of the nurses I have come across because some of my students is in Singapore, Malaysian nurses in Singapore. What happened was they was told that they was told off, no nurses, no renting for nurses, you know. All these challenges they have to go through because of deficit knowledge, not only for the nurses and also for the public. The nurses have to make a great decision making. Okay, at that point of time, the ICU beds is a great challenge, right? So the nurses at some point have to make a decision: who are the right person to be in ICU? Who are the right person that we wanted to put in a negative pressure single room? So all this thing is a very, very difficult decision that the nurses have to do at a certain point. But the knowledge at that point of time, we don't have adequate resources for us to refer to. Okay, so we have to make a certain decision that is very tough decision with the scanty resources that we have, but to ensure, with the keeping in mind our patient is being taken care of. We also have some challenges in getting used to the new devices that be introduced at that point of time. For example, even doing a nasopharyngeal swab at that point of time, some of the nurses is not aware, so we are not really used to it. So we have to take the challenge and we have to learn it ourselves at the initial stage before the Ministry of Health come up with the proper SOPs, how to do it. And some of the devices was very challenging, like for example, of transporting patient, COVID patient using isopods, how to deal with negative pressure room, how to do with the PAPR, and how to use the incubator, intubate a COVID patient with using the box, you know. So all of this thing is a great challenge that we have never gone through, that we have to take really do our maximum to learn all this thing in a very, very limited time. And we also have faced a lot of challenges by having this work-life balance the nurses have to continue to work double shift to accommodate the shortage of nurses and to cover their colleagues who are being quarantined or even their family members have been quarantined. So they also have the challenge. Some of my nurses, I really have to say, some of the family members say, no, you don't come back because we don't feel safe. You are around at home, you know. So all these challenges that the nurses face, so we have to provide hostel for these nurses because the family members feel really unsafe with them around. So I know you and me as a nurse have really experienced all these challenges that we have gone through during this very difficult period of us, especially for these 2 years. Okay. And also some of the nurses, when they got the COVID-19, some of my nurses when got COVID-19, it's been get blamed. You know, the psychological effect was very, very great, whereby they've been blamed by the family members because they was told, okay, they've not been supported in a way. Yeah? So all this issue that's happening, but now we are ready, like more or less already gone through this difficult part. But something that we really wanted to highlight here, I put on all this issue that's happening, I'm going to concentrate on the shortage of nurses or human resource. That's what is being highlighted in this year Nurses Day as well. You know, there is a shortage of nurses worldwide, okay? That's a major issue that I've come across with all this, the lesson that I've learned throughout this pandemic. So the nurses' need is really great, not only in Malaysia, throughout the globe. So that means we have to do something about it. Before we know to do something about it, we must know why there is a shortage of nurses, right? We have to know the cause before we can come out with a solution, right? So basically, we have to know that, as I explained just now, very lengthy. Of course, it's because of the imaging of the new disease. So we know there is a new emerging disease such as COVID-19, increase the workload of the nurses because they have been quarantined, like what I have explained just now. So all these things have caused a lot of workload for the nurses, and there a sudden increase in patient number and sudden increase on the needs of the patient. Like for example, the majority patient is going to ICU. So the ratio of 1 to 1, you know, it increase. So in a way, the need of nurse increase. Okay? The second one is also a global issue that we sometimes fail to address, is the aging population. So globally, we know all of us, including Malaysia, we are in the aging population. So the aging population increased by 70% compared to the last 10 years. So because of the facility, that healthcare facility that we have, we do have increased in aging people. So with that in mind, we know that we have a lot of non-communicable disease as well. Mentioned diabetes and all this thing. For that, to care for that, we need to have nurses as well. Immobility rate going to be increased as well. So for that, we need nurses to care for these people, right? An aging workforce. This one I just got it from the WHO, you know, aging workforce. I was so amazed to see this statistic that 1/3 of nurses globally, this study has been done in US, 1/3 of nurses globally are above 50 years. So that means most of us, I know some of you are already 50 above. So we are expected to retire by 10 to 15 years, right? So there is a limited new workforce generated. Either the new generation is not feel attractive to be a nurse. They're not interested to be a nurse because of the package that is offered is not being attractive. And they have some issue in recruitment as well. So this is the issue that we face. So we have to balance the new generation, the junior and the senior ratio equally. Otherwise, we will have a great problem within 10 to 15 years. Burnout rate. Rates of new graduate nurses leaving the profession this is also a US statistic, 8 to 37% globally, depending on their geographical area. Okay, So some of the area they feel it's okay. Some of the area whereby they don't have a proper standard and policy, they find it's really burnout because their working hour is long. They're not being supported by the colleague, even by the superior. So the burnout rate become very, very high. And they don't have a proper career pathway. And all this thing can cause a burnout for the junior nurses. Then the fifth one is work-life balance. As all of us know, we know there's some male nurse around the corner as well, but majority of nurses are female. They tend to face a lot of challenges during their childbearing age, causes them to quit if not being well supported. Especially we know they go for maternity leave, and again they go for maternity leave, and then the child is sick. If let's say the superior is not really supportive, not really caring for these nurses, and we are not giving them some sort of flexibility when they're working, this caused a great challenge for them. So the tendency for this age group to quit nursing is very, very high. Okay. Career development. As a study showed, major nurses, they're not really aware of their career pathway. They know they want to be a nurse, they will be nurse forever after 20 years, right? So a proper career pathway need to be informed at the very beginning as a junior, so they are aware what are the things that they can do as a nurse and what are the career pathway that they go through. Violence. Okay. The last one is the violence. Nurses are the high risk of violence in all parts of the world, especially in the workforce. Why it happened? Because not only by their senior, junior, violences, whereby sometime they will be verbal violence, whereby they will be belittled by the senior, especially when they're asking for certain things, because in our nursing curriculum, not all the procedure is being taught. So some of the procedure they have to learn when they become a registered nurse. So they have to be well supported so they're aware of how to go about it. Some of them, to some extent, not only verbal violence is there, sometimes we can have physical violence as well, whereby we have come across some of the senior nurses or other healthcare personnel throwing some equipment to the junior nurses as well. So this causes violence in the workplace, especially for the junior nurses. Okay, what we wanted to do for that, we as a professional people, and especially who are the senior person, we have to care, because the nursing philosophy said we have to care, not only for the patient, we also have to care for our staff. We have to care for the junior who are going to uphold this profession as a nurse, because all of us are going to retire one day, and the person who is going to carry this profession is the junior, right? So what is now I'm going to talk about the main topic is about investment in nursing. So investment is in nursing is equivalent to investing for the global health. So if you invest for the nurses, that means you are indirectly investing for the health of the global health, whereby the workforce, the majority workforce in healthcare is nurses. First of all, I already have some subtopic whereby I'm going to talk about one by one. First of all, what we're going to invest, since we already know all this issue that we have here. So we have to create more educational opportunity for all the nurses. Okay, we have always said that it's very difficult to recruit nurses. It's very difficult to persuade the junior people to join nursing and what. But our educational system, nursing educational system, is flexible enough for all these people to enroll in nursing. Especially the person who already become a care assistant for so many years. They already get their income, they have their family to run and everything. Are they flexible enough? So we have to, as the nursing leaders in nursing, must really look into it. There must be a flexible way of teaching learning session, especially for the care assistant or what they want to do, pursue they study to become a registered nurse. It must be flexible. Even we can do online. So we, especially during this pandemic, we have learned a lot of things can be done online. So I really urge to the authority so that this kind of learning to make sure that we have more nurses in the market, whether in Malaysia or internationally, online study should be imposed for nursing education. Okay, of course, it can be a blend method whereby online continue with some sort of a practical session could be emphasized for all the nurses. This can be, this program can be either basic program for care assistant to be a registered nurse, for the registered nurse with diploma can do their Bachelor of Nursing, and even specialization program. So we are already aware during this period of time, during the pandemic, we're already aware that we have a shortage of critical care nurses. So whereby we all also, without critical care nurses, we are handling the ventilator all the right. So it's okay for them. It must be a proper structured manner. Teaching learning session must be there. So I really urged this specialized program must have some sort of flexibility. This includes the advanced program for nurses, whereby we can create more nursing leaders in the healthcare system, whereby a person who have Bachelor of Nursing, they can do the advanced program for nursing in a master's or even PhD as per online. Second one, the second investment is to create more nursing leadership. Okay, when we see the hierarchy, we always have some sort of hierarchy whereby the career pathway, some of the nurses' career pathway is not very clear. We have to actually increase the nursing leadership within the nurses even when they are very junior. So we have to really have the new roles for the nurses so that they can provide mentoring and education for the junior nurses. So this must be really created even at the very early years, whereby when the nurse come to enroll in one of the hospital, they need to be orientated appropriately before they go for clinical. No matter how insufficient nurses they have in the ward, they need to be orientated properly. So we need proper leaders to mentor them. The leader not necessarily must be a unit manager or a ward sister. It can be a senior nurse who can actually do some mentoring, educate the younger nurses, but they must be recognized, okay, in some form. And also a demonstration of career pathway is very, very important for nurses. Nurses must know what is their career pathway. Like for example, they must know what they can be, okay, what their interest in. They interest in education, they interest in clinical area, they interest in clinical area or research or whatever. So they must be a drawing of a clear career pathway at the very initial period is very, very essential. So this makes them really understand their job as a professional nurse. And creating the proper benefit package is also important. Okay, I mean the benefit of package here is not just about salary and allowances. The benefits that we can provide as their manager or as an employer is also some sort of flexibility. Like for example, just now I mentioned, some of the nurses do quit their job when they are at the childbearing age, right? Because they have very, very difficult, they have difficulty in caring for the baby at the same time being a nurse at the flexible hours. So at the same time, we have to be flexible. So we can, because we are so rigid, we said must have 7 hours working, that is considered sub-working hours. But we have to think about retaining these nurses to us, because this is the difficult period of their life. So we can actually have some sort of flexible package whereby we can tell them during maybe this 1 year, they can be working for only 4 hours. This gives them the flexibility whereby they can care for the family at that certain point of time, and they are aware this company, this healthcare facility really provide them some special flexibility package as well. Okay? And some nurses, sometimes they do request to do only night shift or only morning shift. This really need to be considered as well, because when they ask, that is something that they are looking for as well. Okay? And also the job tools that help attract and retain the new nurses. This kind of flexibility actually do retain and attract most of the nurses, especially the new nurses. Apart from that, empowering the nurses is very, very important. To make sure they know that they are important in that organization is really, really essential. So they must know some sort of authority must be given to them, empowerment must be given to them. In simple as that, like for example, even they are junior nurses, they wanted to select, okay, let's say for example, a simple example I'm giving you. For example, we want to buy a bed. We can ask the nurses to choose because they are the end user, right? So we can give them the privilege to choose, okay, which are the good ones. So they feel that we have power as nurses, not just be as a leader or the manager choose or somebody choose to. So this really can give them the empowerment, and they feel they are important people in the healthcare as well. So in another word, what I'm trying to say, they be empowered and they feel comfortable, and they will be staying and retain in the workplace. Advocating. Okay. We are quite lucky being in Malaysia, especially in private hospital. We have this CCAP, whereby we have standard ratio in the private hospital, right? Of course, in the government hospital, we don't have that. But this kind of standard ratio is give us some sort of standard whereby all the nurses knows that they will be not overworked if we follow the actual ratio. So they not be overburdened by getting a lot of extra patient. Of course, it doesn't apply to government hospital because they never follow that. But however, it will be ideal if the government hospital follow that as well. Some of the legislation and regulation that is stipulated by nursing board is also very important, because some of the nurses cannot do certain procedure. This is somehow is actually covering them from any legal issue, you know. So this is a actually I think Malaysian Nursing Board is doing quite well, whereby they have this kind of legislation regulation for the nurses for certain procedure. So this is something that's good. If let's say they are doing something extra, they have to have privilege, okay, to do certain things. So, and also some of the regulation and legislation that is in part can actually boost the education and recruitment as well. Like for example, we do have like some of the nurses, especially nurses that is practicing nurses, must sit for BLS. So this somehow is give the boost for the nurses that they have to do this BLS education. At certain area, they have to do ACLS, they have to do NRP as well, right? So this actually is a good platform that we have created in nursing in Malaysia, whereby we know that all these nurses must undergo this kind of training for sure, right? Okay. Improved staffing practices can also provide a supportive workplace for the current nurses. So how we want to be supportive, we must make sure that environment is conducive enough What I mean by conducive enough, not to say that we must have sofa or whatever, no. To be friendly enough. So that means there is somebody who can listen to them. If let's say even the unit manager or the ward sister is not listening to them, we do have some sort of a backup in that organization, whereby these people who really need some support can speak up. No matter whether it's a counselor or even it's a human resource, even a manager or anybody who can really give them support when they need. And also with that, we really can recruit new nurses as well, because they are aware that these nurses always been supported by the healthcare personnel. Okay. More or less, I'm coming to the end of my session. So just wanted to tell that the nurses are the backbone of our healthcare system. And as all of us know, the care that is not only for the patient, we are rendered. We are also giving the care for the patient family members. We are advocating for them, even our own colleague. Remember, we as nurses, we only not caring for other people, but we care for our own people, our own family members, our own colleague. Okay, and we also have to we have to educate our nurses as well, so that they can advocate for health for our patient, provide education, and deliver sophisticated treatment, as we already evident during the pandemic period. And also for the bedside nursing, bedside care for the patient. Okay, this is my last slide now.
Really a very amazing talk, very sophisticated.
Sorry. So what actually,
I think it's
it's really amazing picture.
Amazing, because when you went through what the nurses, went through during the uncertain period when we didn't know much about COVID, I felt almost tearful. I mean, it's something that I've forgotten about, but you are right, because there were times when we had to make do, and the nurses had to wear at some places had to wear garbage bags as PPE. It was just quite an amazing time, though was very stressful. It took a lot of courage for the nurses, a lot of courage. And it's amazing to reflect back. But is there any questions? Please post the questions. First, I want to ask, okay, how is it that this profession, as noble as it is, we find it so difficult for people to get into it? For example, there are people who are more likely to want to be doctors or teachers, but not so much nurses. Is it because the number of schools are lacking?
Not because of the number of schools. Like what I said, our curriculum is not as flexible as other curriculum, So we have to actually, for the diploma in nursing, we only have 3 chances for passing actually. So they have to fulfill the criteria, the 5 credit, then only they can enroll in a school of nursing with a certain qualification as well. And the thing is, what I realized, because last time what happened, we do have like assistant nurse, we do have like some hierarchy in nursing as well. But nowadays we have, most of the hospital, we have only registered nurse. So that's why I'm really advocating so that the curriculum must be a bit flexible, whereby whoever interested to be a nurse, they have that there's flexibility to undergo this nursing. Because you see, some of the nurses out there, they can be a care assistant for so many years, They can be 20 years as a care assistant, but they don't have that opportunity to be a registered nurse, just because they don't have they cannot, in fact, they can't be a registered nurse because they cannot just withdraw from their working environment and go for 3 years training continuous. So this gave a challenge on their economical part as well. So if, let's say, the teaching and learning in nursing can be a bit flexible, considering all these people, so it can be actually recruit more nurses, right?
Okay,
And
other than
also,
the, sorry, let me just cut you short there for a while, because other than the diploma, right? For example, degree courses, okay, you hear a lot of, I mean, we are of the age where our children or friends' kids are all taking some degree. And they usually would take like psychology, you know, physiotherapy, even pharmacy. But why is it that this nursing degree program is not as popular as other programs?
Okay. Actually, this is because of the perception of the nurses themselves, because they, like what I said, they have a lot of issue in the hospital about the package that they offer. The flexibility is not there. They have to work for shift. Like psychology, they don't work for shift, right?
Yeah, not
But
glamorous
nurses, they
enough.
work, no glamour enough. Yeah. So that's why we have to be a bit flexible in that sense. So to attract more junior people, because they are totally different generation. So in my opinion, I think that could be actually make them really understand this is a very global job lah, compared to those days whereby we are, we are very strict and we are very rigid. I'm trained from those days matron, so we are very rigid. But nowadays, it's not applicable anymore for this new generation. So we have to learn how to attract these people, especially the junior. But at the same time, we have to uphold our profession as well. But need to be I think, because we are totally different compared to the new generation. How they think? Yeah, this is in my opinion.
Irene Woon says that because it's due to unsocial working hours. I don't believe that, because I think when you said that there is not enough career advancement pathway that is planned for nurses, I think that is the reason. When you actually enter nursing, a lot of people, because you are at the age that's entering is 18, okay, you don't have the guidance to say that you can achieve so much, Jayanti, you can become a chief nursing officer.
Yeah.
Nobody tells them that. And then the package is not attractive enough. So Joanne says here it's possibly due to the salary pay gap as well. And I feel like, okay, I've been a doctor for so long, but when you go into the ward these days, okay, previously not so much. When I was a junior doctor, I feel like we are a team, in the ward. But now I feel like doctors are doctors, nurses are nurses. It's not a team anymore. And I think it's very, we need to enforce, or how do you say it, try to enforce
integrated as well, right? So we are in part in that as well. We are learning.
We are lagging, yeah. Yeah, last time we used
to actually, even in our university, we are looking at one itself when we learn anatomy and physiology.
Sorry, I lost you there. Are you here? Are you there? Is it my fault or your fault?
Yeah.
Okay. So we maybe you can repeat yourself, because you were lagging. We couldn't hear you. We still can't.
So, no, what I'm trying to say here is, am I clear?
Yeah,
What
yeah.
I'm trying to tell here is, we as in the university, we are trying to have this integrated teaching and learning, whereby the medical student and the student nurses will have to go through certain classes together, like for example, like international infection control and BLS, all this thing is a very good start, you know, from the very early point of time. They already know that these are the colleagues that they will be go through when they are qualified later, right? Yeah, that is a very good idea.
Yeah, that's a good idea. But I was just thinking, you know, that there are some medical degree. What they do is the first 3 years of the medical degree, right? They give a Bachelor of Science. So basically, let's say medicine is 5 years, you do 3 years, you get a Bachelor of Science. And let's say you decided after the 3 years, you don't want to pursue becoming a doctor, you still at least go out with a Bachelor of Science. Okay. In actual fact, everybody can do that. Means first 3 years, everybody can do this Bachelor of Science, plus the nurses, yeah, and the nurse comes out as a Bachelor of Science in nursing. You know?
Yeah, correct. The fourth year we can change to up to. Yeah, it's a good idea actually. I think Australia do that, isn't it? Australia.
I'm not sure. So the other thing, I think that the lacking in nurses, we need to persuade more men.
Yeah, definitely, definitely.
I think
yeah, but over the 10 years, we can see the number of
course.
male nurses is really increased, you know, compared to those days.
But can you imagine the number of male nurses is still so much lacking in compared to the women? Is people see it as a women's profession.
Yeah.
So men like it's a stigma, you know, to be a male nurse. I mean, of course, recently there's been more and more, but still, I think we can try to encourage more male nurses. I mean, abolish that that thinking that it is a female profession, and we probably will get more nurses.
Yeah. Actually, we are really advocating. In fact, today's news, for the Nurses Day, I can see all the interview was done on the male only. So in a way, the mass media is advocating for male nurses. I can see that.
That's right.
Really, it's in the today news.
That's true.
Before this talk, I just
in the last 10 years, a lot of gender change. Yes, I've noticed myself. When I first had to scrap out with a male nurse for my cases, it was a bit awkward for me, but and then now it's like nothing. So even I, as a person, have to change with time. Yeah, it's just different. But we still need to try to encourage more men to join nursing. And I really think that it's a profession that is underappreciated. Okay. Still not still not well how do you say not given the right recognition. Yes.
But not in overseas, no, Betty, actually, because I work in overseas before, in overseas we have this role, as we call it, as advanced practitioners. So whereby they work and make a decision by themselves, you know. They work independently and in their own field. Yeah, that's quite interesting. I don't know when it will be really can be practiced in Malaysia, you know, actually.
And I'm sure overseas you don't call the doctor, you call the doctor by name, you don't even bother to call the doctor so and so. Most times that is the thing about it, you know. You work as a team, you don't see that the status difference, so you call it yeah, you can
Mm,
and just call it. They don't feel odd that they don't call the doctor by the with the term
mm,
doctor,
mm,
and the doctor also do not see a need to be, you know, addressed as Dr. So and so. And I think
mm,
the most important part is to actually yes, like you say, to actually encourage them and to tell nurses that the career pathway can be numerous and actually very attractive. Even
mm,
though if you start off, quite poorly paid, but so are doctors.
mm.
Yeah, we all started off very poorly paid. Anyway, I think we will stop here. I will stop the live recording, and then we will stop the